What's going on, guys? It's No just checking in, and today we are doing a video about my blood work. It's more than just my testosterone replacement therapy blood work, but of course that is what a lot of people have been that of course is what a lot of people have been specifically asking me for, so I really apologize. It took a long time. Here with me is Dr. Paul Thomas. He happens to be my dad. He is not treating me or managing my care, but he is a doctor. He knows a lot about this, and he's going to help us understand the blood works. Go ahead and say hi, Doc.
Hi everybody, I'm Paul Thomas. He happens to be my son.
Yeah, buddy. All right, guys, so we're going to dig into this blood work, settle in for the long haul, because we're going to go top to bottom, and I look forward to seeing what we learn. Okay. Thank you for coming on the show, sir.
You're very welcome.
It's a real pleasure to have you here.
Pleasure's mine.
Mic check. Cool. All right. What are we going to go over first? Well, why don't we just start with the most basic of the labs. Let's start with my total testosterone. So right now, after not having had my testosterone shot, I take 200 milligrams a week, as you know, intramuscularly every week. And on day 8, so day 8 since my shot, 8 full days, is the morning of the 8th day, my total T came back at 421. Nanograms per deciliter being the unit of measurement, as you know, and as many of you guys may know. So the range here on this form says 332 being the bottom of the range and 896 being the top. Now this is just the one here. What does that tell you about my total T, given that it's been 8 days? I mean, as a doctor, how do you see that?
So you're a young man, mid-20s, right?
Mm-hmm.
And depending on the lab, you're going to be given a range of normal for what your testosterone should be given your age.
Okay.
And they're talking about the mid-300s to 800 and something.
Right.
A lot of labs will actually put a mid-20-year-old up to about 1100
Right.
as normal.
Yeah, that's what I thought. So that's pretty conservative for...
Right.
Okay.
So when you're doing the testosterone replacement therapy with the shot, you're on the day that you give that shot, as you know, your testosterone shoots way up, probably well over 1200.
Okay.
And then it's going to come down over that next week. And I think the level you have is perfect because at its lowest, what we call the trough, you're above 400.
Okay.
And you probably, if you had a level daily dose, if you're using a gel or a cream or something different, you would want to probably be in the 600 to 800.
Given how often you're giving yourself a treatment,
Right.
which is every day.
But since you're having the shot with the weekly spike and trough, you don't want your spike to be so high that you're having symptoms of high testosterone.
Right.
But you don't want your trough to be so low that you're again low testosterone. So that's a perfect result if you ask me.
Awesome, awesome. So a lot of people have asked me and worried that perhaps 200 milligrams is too much, that I'm overdoing it, it's no longer going to be beneficial. And based on my blood work right now and my symptom relief, you would say that this looks good.
I would say it looks good. Now you tell me and you tell your viewers, are you having any side effects?
Not that I'm aware of. I mean,
Okay.
I'm pretty familiar with the side effects to look out for. I don't believe I'm experiencing any side effects other than some acne on my shoulder. It's something that came on pretty early in my treatment, as I've shared with a lot of my viewers, and it's never gotten worse once it hit the peak of whatever you would call the side effect. It never changed after that. So I just have I'd call it mild to moderate acne just on my left and right shoulder. That would be the only side effect of my entire treatment, other than arguably some water retention.
Right. And you were a young man who suffered some severe symptoms of low testosterone.
Right.
Maybe remind me and the viewers, what were the major symptoms that you were experiencing?
As a lot of my viewers know, and as of course for anyone who might be new, the main symptoms I was suffering were mental and emotional. I did have some of the classic physical symptoms of low T, such as fatigue. I had some erectile dysfunction, but for me, I was in a treatment-resistant depression. I had severe brain fog, a lot of anxiety, and basically I was just in a clinical depression that I could not seem to come out of. I was in it over a year before I discovered via a few blood draws, as you know, that I had very, very low testosterone.
Right.
Yeah.
And for the viewers who may not know this, I give a lot of credit to this young man because through his own research he found peer-reviewed studies showing that low testosterone is associated with depression, anxiety, and depersonalization. Went to his psychiatrist and said, "Doc, would you just humor me and check my testosterone?"
Yeah, buddy.
And it was checked. It was low. He was sent to his primary care
They
physician.
checked it again.
Checked it again. It was low. Almost pulling teeth. Finally was put on testosterone, and within 4 to 6 weeks, I think
We started to experience some relief.
huge relief
Yeah, we
and,
started
and
to
changed your
experience
life. So you're a real pioneer, and thank you for sharing this information with the world.
Well, yes, and thank you for grabbing it and running it. As a lot of you, my viewers, might not realize, my dad, he was open, of course, to anything that might help get me better. But when we discovered the low T, he took a personal interest. He went to conferences. You educated yourself like crazy to get up to speed with it. And now I would say in the local area, I don't really know that there are many doctors that know more.
Yeah.
I mean,
well, what was puzzling was, low testosterone was something that old men had.
right.
And so this was like, what is
Exactly.
going on? And I started checking testosterone in a lot of my other patients who are anxious or depressed,
Right.
thinking, no, it's probably just a coincidence. And I'll be darned if it wasn't like 50, 70, 80% of guys
that had
in
the
their
symptoms.
late teens and 20s who
Yeah.
had the symptoms were low testosterone.
It's crazy.
So then I would send these patients to specialists. They didn't really know what to do. It said, all right, we're going to have to figure this out.
Yeah.
So I did go on a mission to really learn what I could.
Right, which is why it's really valuable that I have you at my disposal, and we can obviously bring this man to you guys, and I'd like to have him be a part of this channel more. It's a shame that I haven't been on that more. So that was a very long-winded opening to this video, but we just sort of wanted to set the tone. We wanted to establish a few things and basically almost do our due diligence, edify ourselves a little bit.
What was your free testosterone? Did they measure that?
Yes, my free testosterone was, I've never seen this unit of measurement, but it was 18.7, and I believe PG/ml, so is that picograms per milliliter?
Yep.
Okay, so it looks like it was 18.7, and the range that's on this piece of paper is 5.0 to 40.0, and mine was 18.7.
Okay.
I'm familiar more with the other one.
Yeah. Is this, what was the name of this lab?
Have a look, sir.
Okay. Let's see here. So it is important if you're having your testosterone checked to know, use the normals for the lab that they're giving you.
Right.
Because there are actually huge differences in procedures used for testosterone. So if you're using Quest or LabCorp, their range of normals is quite different. And I think with this particular lab, we were trying a third lab that has its own separate ranges that we're becoming familiar with. So this is something that a lot of physicians may not be aware of, is there's normals based on age, but there's also normals based on the lab and
Right.
the technique that they're using.
Okay.
So your free was in the middle of the range for your age.
Exactly, it was almost...
And again, that's okay because realize that's a trough.
Right.
So I think you have perfect results. It implies to me that your dose is exactly where it should be.
Based on my total T and my free T.
Exactly.
Cool.